Good afternoon, everybody. Hope you enjoyed a little treat from Prince since this month is actually Black Music Appreciation Month. So I am Rhonda Smith. Welcome to the first session of part two, Making the Healthcare System Work Better for You. So last year we launched the How Do I campaign, which was developed based on the recommendations that came out of the Listening to Black Californians research sponsored by the California Healthcare Foundation. The Listening to Black Californians research was a project to better understand what is happening with Black Californians when they interact with the healthcare system and what that experience is like for them. So the How Do I campaign that was born out of that work is an initiative focused on really helping our community understand how do I do anything that I need to do to make the healthcare system work better for me. And so we want to really focus on continuing that message and helping to educate the community, which is why we've developed a part two of that series. And so if you go to the next slide, we have a quick question just to take a pulse and see. Curious about how many of you here today so far participated in the first part of the series or series part one last year in any of the sessions. If you can take a few minutes and just tell us yes or no, whether you did or not. I see there's a few coming in still. Okay, we'll give it just one more minute. Okay, so it looks like the majority of the people that are with us at the moment did not attend any of the sessions last year, which is still good. So for those of you who did participate in at least one or two of the sessions, then this will be a good opportunity to build on sort of the foundation that we established last year to help people understand how to make the healthcare system work better for them. For those who are new, no fret, you didn't miss too much. Well, yeah, you did, but you can still catch up. All of the videos for the 5 sessions are on our YouTube page. So just go to California Black Health Network there. But today, really, we're starting to focus on giving you some tips and tools and basic application of things that we learned last year, really carrying it forward to help you better understand and put some things into action to make the healthcare system work better for you. So today's session is on the topic of taking ownership of your health. And so participating in the decision-making for your own care is crucial because it empowers all of us to understand, what health conditions we're dealing with, what treatment options may be available to us if we receive a serious health diagnosis. And also to understand what the potential risk and benefits are and implications related to all of that. And so I think it's important to be able to really know how to manage your own health, focus on prevention, do the right things that can prevent diseases from occurring or prevent disease from progressing even more. And so being an empowered patient means really being proactive, making sure that you have a great communications with your healthcare provider and team, and that you all are participating in the decision-making for your care, but most importantly, that you are in the driver's seat for that. So the question of the day is, how do we really take charge of our health and healthcare in a way that does make the healthcare system work better for us? And I think that's an even more important question now, considering what is looming around us with the budget cuts and how that may impact our access to healthcare, our affordability for healthcare, and anything that can impact our health and well-being. And so Dr. Melissa Clarke is our speaker and subject matter expert for this 5-part series. She is the co-author of a book called Excuse Me, Doctor, I've Got What? And it's a book that was created to us really be more empowered patients. But before I introduce to Dr. Clarke, just wanted to go through a few housekeeping things. And so we'll hear from Dr. Clarke, and she'll tell us all about how to take charge of our health. That will be followed by a Q&A, but don't hesitate to put any of your questions in the Q&A box versus the chat, so that we can easily see the questions that are being posed by all of you. And just please note that everyone, since we're in a webinar, you remain off camera and muted throughout the session. But again, if you see somebody you recognize in the chat, feel free to give a shout out. If you want to engage in conversation with someone in the chat, feel free to do that too. But please remember to put your questions in the Q&A box. Okay, so before I begin, since there are quite a few of you that are new, or the first time you participated in one of the How Do I sessions or the Making the Healthcare System Work Better for You sessions, I want to take a few minutes just to tell you a little bit about the California Black Health Network. So next slide, please. And so the California Black Health Network is the voice and trusted resource for Black health equity in California, and we are the only statewide Black-led organization that works to advance health equity for all Californians, all Black Californians. That includes African Americans as well as Black immigrants. Next. So what we do on a day-to-day basis is conduct outreach, education, advocacy and policy work, as well as programmatic work to achieve health equity for Black Californians. And we do that through the lens of understanding what are the critical issues that lie at the intersection of racial justice, social justice, and environmental justice. Next slide. And our vision is really to create, it's very aspirational, but to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we work to achieve that vision every single day by working to ensure that all Black Californians, regardless of how well educated they are, how much money they make, where they live, who they love, how they self-identify, or even what their housing status and place of origin is, to make sure that they have access to high quality, equitable care, especially primary care, as well as behavioral health care. And we also want to make sure that our people are not dying from diseases that are preventable. So definitely not unnecessarily succumbing to different diseases and health conditions. Next slide. So now it's my pleasure to introduce someone that I met about 10 years ago or so through some other work that I was doing in the health equity space. This is Dr. Melissa Clarke. She's based in Washington, D.C. and is an author, TEDx keynote speaker, health show host, thought leader, physician, educator, population health expert, and I find out today she's a golfer also. But she's a Harvard-educated emergency medicine physician with over 30 years of healthcare experience. She has been on the front lines of addressing health disparities, health literacy, and improving the way doctors and patients work together for many, many years. She's also a medical contributor to the Russ Parr Morning Show and has made numerous television and radio appearances, including on CNN. I mentioned her book earlier, Doctor, I've Got What, is a roadmap to help all of us understand how to be a smart healthcare consumer and understand why, especially now, taking control of your health and healthcare is more important than ever. Based on her book, Dr. Clarke also hosts and is a co-creator of Excuse Me, Doctor with Dr. Mel, a live weekly health forum on SiriusXM, and is streamed on YouTube and Facebook, where she provides urgent information and answers audience questions in real time every Monday night at 6 p.m. So please make a note that 6 p.m. Pacific time, 9 p.m. Eastern time. And she has served as a keynote speaker at different conferences and has done many, many TED Talks. So I don't want to say anything more. Dr. Melissa can tell you more about herself, but don't want to delay hearing great information from her any longer. So I'll turn it over to you, Dr. Clarke.
Well, thank you so much, Rhonda, for having me here today. And I am just going to go ahead and share my screen. Hopefully everyone can see that. And you know, I want to also thank the California Black Health Network. I so am aligned with the work that you're doing. I'm your cheerleader. It just takes the work that I do to a whole new level, and I'm just really happy and grateful to be here today. And I have to commend you to the audience for tuning in because this tells me that you all are super tuned in to your health and you want to understand how to be empowered when it comes to your health and your health care. So, uh, clap yourselves for tuning in today. So, I'm going to talk a little bit about today really being health empowered, taking ownership of your health. And really, we're going to focus on, why it is that we have the most control over our health and over our health. And as Rhonda said in the introduction, being able to do those things that help prevent chronic disease from happening. And if we already have it, keep it from progressing. And I just want to say, one of the reasons why I'm really passionate about this work is that I'm an emergency medicine physician by training, and being in the emergency department, I worked in Washington, D.C. for years at Howard University Hospital. I saw any number of patients who were there who had fallen through the cracks of the healthcare system because of social circumstances, because of poor communications from their doctors, because of misunderstandings around medications, just the gamut of things. People ended up in the emergency department. Um, and I really felt that it was important to go on a mission to really go more upstream from taking care of folks in the emergency department and really talking to audiences about how to be more health empowered. And so I've really dedicated my career to that. So, I'd like you to pause and think when we talk about health empowered, health is the centerpiece of that. And so, really stop and think, what does health mean to you? It means a variety of things to a lot of people. Oftentimes, this is some of the word salad, if you will, that results when I ask that question. It's full of different uh, words that come to mind when you hear the word health. Um, and I like to think of it as being on different levels, right? You have social health, meaning you have the support systems that you need. You have the relationships, your village around you to support you. Of course, physical health, which is sort of the default for many people, where your mind goes first, thinking about, well-being, exercise, a well-balanced diet, just a body that works, right? And does the things that you want it to do. There's intellectual health, being open to learning and being curious and expanding your knowledge and your skills. There's emotional health, being able to recognize and accept your feelings. And really importantly, we're going to talk about this a lot later, dealing with stress. And then, of course, spiritual health. Very important. Living in harmony with others, appreciating the meaning of life, having a strong set of personal values and beliefs outside of yourself. And so when we think about health, we could be thinking about it on any of these levels, but we know that it's the complete physical, mental, emotional, social, and spiritual well-being, not just the absence of disease or infirmity. And so, as I mentioned today, we're going to talk about being health empowered, which really means knowing that most of the health conditions that we have a common source and that we are able to impact those factors that address that common source. And we're going to get into all of that. And then also, we're going to talk about um, starting with why we have the most impact on our own health, but then we're going to move to what are the 5 self-health actions that result from knowing how we can impact our health. There are 5 key ways in which we can impact our health. We're going to go over all of that. So let's talk about first why we have the most impact on our own health. A lot of people feel that they don't. They feel that, they might not be able to have an impact or control it. They might think, certain diseases run in my family. My mother had sugar, my dad had arthritis, everybody in my family has high blood pressure. And it is true. Some of our health is determined by our DNA, by our inheritance. But I think I want to put a little different spin on it, right? Um, if you are here listening to me, you are a genetic success story. The DNA that your ancestors gave you helped you survive all kinds of things. They they survived all kinds of unspeakable things, and they passed those genes that allowed them to survive. They passed those on to you. And it's allowed you to be here today. It's really your divine inheritance, your blueprint for success, and you pass that on to your children. Another concern I hear, when we talk about, being able to impact your own health is, I'm too old to change, right? Or you just can't teach an old dog new tricks. And that is absolutely not true. Our bodies are amazingly flexible and resilient at any age. So this picture of the dinosaurs on the left reminds me of my father-in-law. And I say that because he was a smoker at one point in his life. When I met him, I've been married 19 years now, so I met him 20 plus years ago. Um, he smoked. He had been through addiction, and at the point that I met him, he had not used in 14 years. But he had had a mild heart attack and he had diabetes. He was in his late 60s at the time, and about 3 years after I met him, he just decided, I'm going to stop smoking. And he did, with the help of a patch and, coaching and his doctor, he was able to do it. Then his doctor said, "Hey, look, man, you got to lose weight. I don't know too many 300-pound um, men in their 70s, and you're pushing up on 70. I'd like to walk with you on a weight loss journey." And he lost 50 pounds. He had to get a whole new, I call it cat daddy wardrobe. He was looking clean, looking good. He started going to church again because he could walk better. His knees didn't hurt as much anymore. Um, and I just want to say, it is never too late to change. And for him, it worked out wonderfully in terms of the health benefits that he was able to have. He eventually came off of insulin and all of his diabetic medication. And then on the right side of the slide, I don't know how many of you all recognize this beautiful woman. Her name is Ernestine Shepherd. She lives in Baltimore. She's a mother, a grandmother, a retired school secretary. She holds the Guinness Book of World Records for the oldest woman competitive bodybuilder in the world. She's been nicknamed the Six-Pack Granny by Ripley's Believe It or Not. And now, and she's even appeared in a Beyonce production. So I don't know if you know her story, but bottom line is she started working out when she was 56 years old. Today, she's 89 and looks just like this. I think this picture was taken when she was in her mid 80s. She's still an active bodybuilder. And it just goes to show you that, again, at any age, we can have tremendous influence over our own health. So, why is it that we have so much control over our own health? How is it that our bodies can respond when we give them what is really needed, like the little sister on the left eating the carrot, as opposed to some of the other things that we've historically had to make do with that may not be as healthy for you? And we have to really start with the realization and the mindset that we have control over our own health. So I'm going to break that down. I want to start off and ask each of you, how many of you consider yourselves creative? You can put it in the question box or wherever is appropriate to answer. If you consider yourself creative, so my poets, my spoken word folks, my singers, my dancers, my artists, my pottery makers, all y'all out there, how many of you consider yourselves creative? All right. Well, I hope that all of you answered, I am creative. And this is why. Did you know that our bodies generate a new liver about 100 and every 150 days? That means that the old cells in your liver, as they die off, your body is constantly creating new liver cells. And you basically get a whole new liver turnover in 150 days. The same is true of our taste buds. We have 9,000 taste buds, and they renew every 10 days. So that's why if you can just go 5 days, if you want to eat less sugar or eat less salt in your diet, and you can make it 5 days on less sugar or less salt, you reset 50% of your taste buds to now expect a lower amount of sugar and a lower amount of salt, right? And if you can go the whole 10 days, those brand new 9,000 taste buds are expecting now a lower amount of sugar or a lower amount of salt. So that's really key to know. So your body is constantly creating itself every single day. That is why we are all creative. And the other thing is, it's constantly repairing itself. Did you know that up to 100,000 cancer cells form in our body every single day? And if all goes well, which it usually does, they get destroyed. So, how does this happen? We're going to talk about that. The reason that things go wrong in the first place, cancer cells pop up, viruses, bacteria that we're exposed to, we're constantly being exposed to environmental factors that can throw off our body chemistry. Everything, like I said, from viruses to bacteria to chemicals in the environment to things that we eat and ingest, creams that we put on our skin, all kinds of things get into our body. And therefore, they throw our body off balance. But again, the reason why those 100,000 cancer cells that pop up every single day because of all these different exposures don't go on to cause cancer in all of us all the time is because our body is constantly repairing itself. Our bodies are designed for wellness. And so your body's process for dealing with this is called inflammation. A lot of you probably have heard of that term. And it's actually a good thing in most instances. So if you've ever had a cold, if you've ever twisted your ankle, if you've ever had a bee sting, then you know what happens. In each of those instances, you get swelling. So with a cold, the inside of your nose swells up in response to a cold virus in your nose. Twisting your ankle swells up. If you get stung by a bee, the spot where you got stung, that swells up. That's inflammation at work. That's your body sending cells that are specifically designed to repair and defend your body against anything that it comes up against. So cells get sent to neutralize that virus. Cells get sent to your ankle to start repairing the ligament that got stressed or torn. Or cells get sent to the area where the bee sting is to help neutralize the stinger and anything that the bee may have injected into your body, right? So those cells are there for cleanup. And it doesn't matter what the threat is, generally there's some kind of swelling and some kind of response. And that's normal. That's normal inflammation. But if your body is off kilter, and we'll talk about the things that make your body off kilter, then that inflammation never stops. It just keeps going and going and going. And then it becomes something called chronic inflammation. Chronic meaning never ending, right? Inflammation. And it turns out chronic inflammation is the root cause of most of, if not all, chronic diseases in our body. Everything from Alzheimer's to arthritis, from colon cancer to cardiovascular disease, so things like heart attack and stroke, everything from asthma and allergies to diabetes, even gingivitis, the swelling of our gums, when you brush your teeth and your gums bleed. So chronic inflammation is the root cause of so many of the chronic diseases that we come in that plague us. And now, where chronic inflammation happens in our body, where we're sort of most prone to get it, does have something to do with what we inherit, our genes. So, if we have a genetic predisposition for ulcers, for stomach ulcers, then chronic inflammation will likely show up in the form of stomach ulcers. Um, or if we have a predisposition for high blood pressure, uh, we will chronic inflammation will show up as high blood pressure. But if basically how severe it is, right? The disease is, what age it is when it shows up, or if it shows up at all, has so much to do with what I'm going to call the 5 self-health actions that we're going to go over shortly. So these are the 5 self-health actions that really can impact the level of chronic inflammation that we have in our body that we experience. So what we put in our bodies, toxins that we're exposed to, movement, sleep, and managing stress. Those are the 5 self-health actions that we're going to talk about now. And if we're sort of not doing them and our body is out of balance, that's when we have chronic inflammation progress and eventually show up as disease. And by doing them, again, we can minimize chronic inflammation in our body, prevent disease, or if we already have it, prevent it from progressing. So let's jump right into it. The first one, what we put in our bodies. And I call this not dieting, but strategic eating, being intentional about eating an anti-inflammatory foods. So it really means giving our bodies the right nutrients that provide a healthy environment for our body to create itself. Like we talked about, we're all creative, and our body to repair itself every single day. And conversely, on the next slide, we're going to talk about avoiding those foods and later those toxins that can promote inflammation or chronic inflammation in our body. So strategic eating means including healthy fats, um, like avocado, fish oil, omega-3s, coconut oil. These healthy fats are needed to create new nerve cells. They're needed to clean up and repair our blood vessels, put healthy cholesterol, and cholesterol is not a bad thing because there's healthy cholesterol in our arteries and making it so that blood flows easily to all of our vital organs. Of course, fruits and vegetables, a plant-based diet. Now, I'm not saying don't eat meat. I'm not saying that. But if most of your plate is meat, that's probably not a good thing. You want most of your plate and what you eat throughout the day to be fruits and vegetables, because when you eat the rainbow, all the various colors of the fruits and vegetables that we encounter, green, red, yellow, purple, orange, they are actually giving us different, very important nutrients in our body that are responsible for the creation of cells and the cleanup and repair when there's damage to our cells and minimizing chronic inflammation in our body. And they also give us fiber, which helps to clean out our colon and keep us and give us healthy colons. Um, and just an example, the red in tomatoes is something called lycopene. And when you cook tomatoes, it actually activates the lycopene even more. And it's a really key nutrient that helps to prevent the formation of prostate cancer in men and breast cancer in women. Um, a study of adults with mild high blood pressure showed that just 4 daily servings of cruciferous vegetables, those are things like cauliflower, broccoli, bok choy, for 2 weeks, um, helped to lower 24-hour blood pressure readings by an average of 2.5 milligrams of mercury. That's just 4 servings over 2 weeks. So doing it continuously can definitely help to bring down your blood pressure. I also want to call out on here vitamin D. Vitamin D is found in fatty fish like salmon. It's found in some nuts. And it is linked to just about a low vitamin D level is correlated with so many different types of chronic disease, everything from multiple sclerosis to cancer. It's also a low vitamin D correlates with falls in older adults because of poor balance and weakening muscles. So making sure that you get enough vitamin D in your diet, and if the darker skin you are, the more you have to focus on it because vitamin D comes from exposure of our bodies to sunlight, and the melanin in your skin can block that. So you want to make sure that you're working with your doctor, getting your vitamin D level checked on a regular basis, and getting in enough vitamin D every day. So lots on this slide, but really pay attention to all these things because they're definitely anti-inflammatory. Even dark chocolate, 70% or higher cacao content is anti-inflammatory. So you can even get your chocolate in on this diet as long as you're not, the 70 to 80% chocolate bars tend to not have a lot of sugar in them, and so they can be very healthy for you. Now, conversely, these are some of the things that we want to avoid. So processed meats. So these are things like, I know y'all may not want to hear this, but bacon, sausage, hot links, hot dogs, deli meats. These are all things that promote inflammation in our body versus better choices, lean poultry, fish, or plant-based proteins like beans or lentils. The other thing you want to avoid are highly refined carbohydrates. So things like white bread, pasta, pastries. These things spike your blood sugar level, which are not good for for inflammation in general in your body. Of course, fried foods. We want to avoid fried foods whenever possible. And, oh, sorry. And uh, excessive processed snacks and packaged foods tend to have lots of salt in them, as well as other food additives that promote inflammation in your body. So you definitely want to avoid that, along with sugary foods and sugary beverages. If if you can avoid it all, drinking sugary beverages and focusing on water, more often than not, you will be doing yourself a great service. And speaking of water, our body is 75% water. We got to give it water every day so that we can stay well hydrated. Just um, making sure that we're cleaning out waste products out of our body, making sure that we are um, flushing our system out, giving our body enough water so that we can have easy bowel movements. Very, very important. And these are some of the consequences of dehydration if you're not getting enough water. So in a short period of time, just a few hours, if you're dehydrated, you can get headache, just feeling tired, mood changes, a little irritable, your problem-solving ability goes down. And then if you have moderate dehydration, that happens, say, in a day, you might have problems learning, problems remembering, even feeling a little lightheaded. And then chronic dehydration, you're just not getting the amount of water that you should every day. That could lead to really serious things like kidney stones, constipation, joint pain, weight gain, and even high blood pressure. So how much should you be drinking? Your urine looks light colored, much like the color of this that talks about light colored urine. Um, Other people use a thumb of 8-ounce glasses a day, but it's really good, especially if you have any underlying kidney disease or heart disease, to talk with your doctor about what is the lot, you drink alcohol or drink a lot of caffeinated drinks, you actually need to drink more. And then I like to make sure that I'm getting enough water, carrying a thermos or drinking 2 glasses of water before each meal. And that way I know that I'm getting it in, and then after my last meal, drinking 2 more glasses. And flavored water sometimes helps people, for those people that don't like the taste of water, you can add fruit to it, and that makes it a really healthy drink. All right, so that was number 1, what we put in our body. Number 2, avoiding things that we know do harm to our body. Number 1, cigarettes, tobacco, smoking. And you really want to um, it's really important to know that even within hours of not having a cigarette, you have improvements in your body. Within weeks, your lung function improves, making breathing easier. The lungs start to repair themselves, reducing the risk of breakdown of the lungs, COPD. Um, Mucus clears away. And then we know that smoking is a risk factor for heart disease, stroke, and various cancers. So just after 1 year of quitting smoking, your risk of heart disease drops by 50%. Really key. And the same for your risk of strokes. The risk of um, lung cancer takes a little bit longer. It takes about 10 years of being smoke-free for your risk of lung cancer to go down. But there are immediate benefits of quitting smoking. The other is alcohol. Now, for for men, the recommended amount of alcohol is 2 drinks a day. For women, it's 1 drink a day or none or less, according to the dietary guidelines for Americans. It's also recommended that you have several alcohol-free days per week. And the reason why is, you all may have known people who drink chronically over time. They might develop liver disease or ulcers, stomach ulcers. Um, Weight gain is associated with it. But in general, a lot of people don't know that it can weaken your immune system. In men, it can decrease your sperm count and your fertility. And a big one that a lot of people don't know about is the association of alcohol in women with breast cancer. So actually for that, there's really no safe amount of alcohol to drink for women because it's all increases your risk of breast cancer. And then finally, under the toxins category to avoid, hair dyes, hair relaxers have an association with breast cancer. We've seen recent studies that show a 60% increase in risk of breast cancer for women with um, uh, for exposure to these kinds of toxins. So permanent hair dye is about 9% more likely. Hair straightening chemicals, about 31% increase in breast cancer risk. And African American women who use hair dye every 6 to 8 weeks, 60% more likely to develop breast cancer. And the darker the color of the dye, the higher the risk. So again, a lot of people don't know that, but really important to keep in mind. All right, so now number 3, we've talked about 1, what we put in our body, 2, avoiding toxins, 3 and 4. 3 is movement. Movement is so critical to decreasing our levels of inflammation. When our muscles contract, so when we move our bodies, it releases chemicals into our bloodstream that automatically bring down our inflammation level. That's one of the reasons why exercise is so important. So even if you're not doing it to lose weight, which is one way that it really kind of boosts your metabolism and helps you to keep your weight in check, it also helps to decrease your risk of multiple diseases, everything from cancers, different kinds of cancers, to heart attacks, to strokes. It improves your sleep. So there are just numerous benefits to just moving. Even if you're gardening, getting out and walking, doing the honey-do list, whatever it is, just move. And then number 4, sleep. I say people who don't get enough sleep have a dirty mind. Why do I say that? And it's not because Prince had a song called Dirty Mind either. I know we started off with Prince. It's because when you go to sleep, your body goes through 4 different cycles of deepening sleep. And in each of those cycles, different channels in your brain open up and release the toxins that have been built up in there during the day. And that's why getting 7 to 8 hours of sleep is so crucial. Because each cycle takes about an hour and a half to 2 hours for your brain to go through. And so the 4 cycles, therefore, 4 times 1.5 to 2 is 7 to 8 hours. So that's where that magic number of getting 7 to 8 hours sleep comes from. And if you're not getting great sleep every night, there's a concern that down the line you might develop diseases of the nervous system, like Parkinson's disease or Alzheimer's. So if you're not getting enough sleep, it's really important to practice good sleep hygiene. You see the tips there, getting a routine around bedtime, sleeping in a cool room, not eating within 3 hours of bedtime, avoiding alcohol as a sleep aid, because even though it might knock you out, the kind of sleep you get is not restful sleep. Limiting, this is a big one. This is a hard one for me. Limiting screen time before bed. So not being on the computer, not doing the doom scroll up until midnight when it's time to go to sleep. And then keep your room cool and dark. Those are great ways to make sure your body's getting restful sleep. And then finally, sleep apnea. It's an epidemic in America, and especially in the Black community. It's not getting enough air into your lungs when you sleep, so your oxygen level goes low. Oftentimes, people that snore or gasp um, uh, or wake up out of their sleep frequently during the night have sleep apnea. If you have new onset high blood pressure, new onset diabetes, those are also consequences of sleep apnea. So if you have any of those things, really important to get checked out by a physician, by a doctor, to see and get assessed to see whether you have sleep apnea or not. And then last but not least, Actually, what I think is the most important is managing stress in your life. So, again, the stress response was something that, our ancestors had when they were, out on the plains, running away from the lions or the tigers or the bears, or having to stop and fight and defend themselves. It is your cortisol level, which is a hormone in your body. It goes up. It sends blood to your muscles. It makes your eyes dilate so you can see better. All these different changes happen in your body when you are in a situation that's threatening, right? Um, and that's our fight or flight system. And what happens is 100% of your energy in that moment is going towards defending yourself. So you don't have the bandwidth, you don't have the energy. It doesn't go into repairing things in your body or creating new cells, right? Your body's like, nah, we have to focus on this immediate threat right here, and we have to get away from it, and we have to defend ourselves, or we have to run, right? So that gets us over, the 5-10 minutes. But the problem is in today's world, as opposed to our ancestors' world, we have all these things going on that are constantly making us feel that we're in a state of chronic stress, right? So we have bills, we have the kids, we have the parents, we have work, we have traffic, we got COVID, we have all kinds of things that are stressors. We're at war now, right? So all these things can weigh on our mind, which keeps our cortisol levels up here. And what does that lead to? Chronic inflammation. Um, but I think it's really important to keep in mind that stress can be managed if you consider it in this way. So we all have these things outside of us, stressors that, we can respond to. But um, the thing that happens to you is the stressor. How you interpret it is whether you feel stressed or not, right? So I like this picture of the roller coaster. You'll see that the people in the back, arms up, they're having a good time, or, yeah, having fun. The two guys in the middle are terrified. They're biting their nails, they're scared to death. And then the guy in the front is on his cell phone, probably talking to his girlfriend. Yeah, I'm gonna meet up with you at, the Ferris wheel in about 20 minutes, right? So they're all having the same experience, but they're managing it in different ways or responding to it in different ways. So the key to managing stressors in our lives the key is to develop your daily rituals that help you manage stress. And there are research proven ways that do it. So you see some of them here: yoga and Tai Chi. Those are two forms of exercise that help you center and align and bring down your cortisol levels. Prayer and meditation, also two research proven ways that help to bring down your cortisol levels and therefore bring down inflammation in your body. And then volunteering, seeing people that volunteer have lower levels of stress in their lives. And the common experience of stress is, the definition is feeling like things are out of your control, feeling overwhelmed. And so I think people who volunteer have a more of a mindset of, um, I have enough to spare and to share. So I don't feel overwhelmed. And by giving, you're actually receiving. You're receiving lower levels of inflammation, lower levels of cortisol in your body. So just to recap, you have a powerful influence over your own health because you control what controls chronic inflammation. The things we put in our body, avoiding toxins, moving every day, getting 7 to 8 hours of sleep every night, and managing the stressors and stress in your life. So I'm going to stop here and take any questions that you have. Actually, I included this slide because you might feel, that there's something that you heard that you want to make a goal out of here. And so for goal setting, for your health, it's really important to make a goal that's realistic. Like you're not going to climb Mount Everest tomorrow if you've been sitting on the couch for the last 6 months, right? So you want to start small, make it realistic, create a doable action plan, and set goals that you think you will enjoy and be able to stick to. And then have an accountability plan. A lot of time that's partnering up with people or telling people in your family or in your circle who you know will be supportive and can help you along the way. You can have your healthcare provider even be your accountability partner. And then as you add new habits to a routine that you're already familiar with, that makes them even stickier and new habits to stick to that help you get to your goal. So I'll stop here and I'll take any questions.
Thank you so much, Dr. Clarke. We do have a few questions in the Q&A box. And so the first question is, how do you reset your gut microbiome?
Great question. Well, if you go back to the anti-inflammatory slide, a lot of those a lot of the things that I suggested, especially around the plant-based diet, giving your body enough fiber, eating the rainbow of all the assorted fruits and vegetables of all different colors, getting 7 servings a day, that is exactly what your gut needs to be able to be reset. Another key part of that is fermented foods. So think kimchi, think tempeh, think yogurt if you don't have dairy intolerance.
That kombucha also?
Kombucha is another excellent example of a fermented product. Your good bacteria in your body, in your gut, love that. And I forgot to, not everybody probably knows what the microbiome is. It's our gut is full of bacteria, and those bacteria help us to break down our food and create nutrients. And it's there, and in order to preserve the right balance of the good bacteria in our body, we want to eat the right foods that help to feed and nourish those bacteria. And a healthy microbiome has been linked everything from, again, decreasing chronic inflammation to our brain health, to diabetes, improving diabetes, again, all through that link of decreasing chronic inflammation.
Great, thank you. And then someone wants to know what measures they can take for women, especially in their 40s, who are pre-diabetic but have no other health conditions. I would assume to prevent pre-diabetes from escalating to full-blown diabetes.
Yeah, the 5 self-health actions. That's key because pre-diabetes and diabetes is being driven by chronic inflammation. And the thing is, disease doesn't show up in our bodies overnight. It takes time to develop. And so if you have pre-diabetes, you've been fortunate enough to basically, have a warning sign like, hey, you're on the verge of diabetes, but you can reverse it. And the 5 self-health actions, everything that I mentioned, are ways, research proven ways to address prediabetes and return to a normal blood sugar and A1C.
Okay. And then someone wants to know what your thoughts are about oils. This is like avocado oil, olive oil.
Yeah.
So she says she has a colleague, a cardiologist, I won't say the person's name, but who says that all oils are inflammatory. So it's okay to eat avocado and nuts, but no oils, even including olive oil. So
Yeah.
what are your thoughts and perspective
Um,
on?
I had not heard that. I'm not familiar with the research that says that. As a matter of fact, um, plant-based oils are, to my knowledge, are good for you. And I actually even mentioned some of them. Avocado oil, coconut oil, are healthy oils that help to regulate our blood cholesterol. Cholesterol is not a bad thing. We need it. It actually um, is the lining of all our cells that they're made of cholesterol. You just have to have it in balance. And so those plant-based oils help us to get it in balance.
Great. So there was a question, I believe it was in the chat, and when you were talking about smoking, they want to know about people who vape. I think a lot of times, especially young adults who vape, think it's cool, but think it's also safer than smoking cigarettes. When in fact there is nicotine in, products and vaping products. So can you
Yeah.
elaborate a little bit more on the
Yeah.
health
And
associated
sure.
with, yeah.
Not only nicotine is in vape, there are also many chemicals that are in vape smoke that, again, when I talked about avoiding toxins, those are the very chemicals that lead your body into that sort of cycle of chronic inflammation. If you're constantly putting those things in your body that your body doesn't want and are not healthy for your body. So no, vaping is just as harmful as cigarettes.
Yeah, so there's a lot of good questions popping up in the chat and as well as here in the Q&A box. So hopefully people can stay around and we can get them all answered. But there's one question that unfortunately I don't think this person was at our webinar on Saturday. And I'm not sure if you're able to comment on this, but she wants to know what hair colors, dyes, or cellophanes are safe or safer to use that don't have carcinogenic products in them. So I don't know if you're able to address that, but
Yeah. I'm not able to give specifics, unfortunately. But if it was in your webinar, maybe they could go back and listen to it
yeah,
and get the
yes,
specifics.
yeah. So just an FYI for the person who asked the question and for everyone else, especially for all the Black women who may be here today. We hosted a webinar on Saturday as part of our work around the conscious Black beauty movement to help educate our community about the toxic chemicals that are in hair care and personal and beauty products that are specifically marketed to Black women and girls and all the different health conditions that are linked to that. So we're educating folks about that, but also what are the options for safer, cleaner choices that don't contain those harmful chemicals. So if you look at things that contain phthalates, other endocrine disrupting chemicals, if you read the label and it has, 10 syllables, it's probably not good. But happy to follow up with you, Teresa, or sorry, the person who asked the question, and get more information to you about that. You can also visit our website. So go to cablackhealthnetwork.org and look under programs for the Conscious Black Beauty Movement. Or if you just Google Conscious Black Beauty Movement, it will pop up and you can read more about that information and what products to stay away from. There's also a list on the website page of 80 Black-owned brands that have been vetted and certified or deemed to be toxic free and safer than some of the alternatives. And we had some of those Black-owned brand owners on the webinar on Saturday. So sorry if you weren't able to attend. But one other question, someone wanted to know about, well, exercise for Black women and how important that is. I mean, if you look at the statistics,
Yeah.
and according to the minority, well, before it was taken down, the Minority Health website, it says 3 out of 4 Black women or African-American women are obese or overweight, which is basically 75%. So back to your 5 health tips. movement is definitely important. Nutrition is definitely important, but want to hear your thoughts specifically as it relates to Black women, if you have a different perspective than versus other women.
Exercise is important for everyone, but let me just say, we as Black women, we die younger than our white counterparts. You mentioned the rates of obesity and overweight. That then leads to higher rates of heart disease. When we get breast cancer, it's more aggressive. Higher rates of stroke, higher rates of diabetes. And so we are under greater amounts of stressors on average when we talk about being Black women in this country. And the beauty of exercise or just movement, as I mentioned, is it can be a physical release for some of that stress that we store in us that then in turn leads to these higher rates of obesity, overweight, stroke, heart attack, etc. And so I would, double down. You might hear a lot of people say, well, you don't need to exercise to lose weight. It's more important what you eat. That is true for weight loss, but it discounts all the other benefits of movement and exercise when it comes to chronic inflammation and decreasing your risk for some of these other diseases that are out there.
Great. And I know we're running short on time or overtime, but if you have a few minutes to stick around to get through some of the other questions, that would be great.
Sure.
Okay. And just I wanted to address a few things that are in the chat. So we will be sending out a link to the recording of the webinar here, so you will be able to review it and share it with your friends and family if you choose to do so. Give us a couple days to get things processed, and we'll send it out by early next week. Also, someone suggests that we do a webinar on Black women in menopause. And actually tomorrow I'm talking to someone who has created a whole kind of movement around menopause and educating women, and particularly Black women, about menopause. So her name is Denise Pines, and her business and company and website is called Wise Pause. But I will definitely talk to her tomorrow about coming to do a webinar for us about the work that she's doing, and specifically as it relates to Black women. So thank you for that question.
Can I also just do a little addendum around the exercise as well? In menopause, a lot of times we have problems sleeping. Exercise can help us sleep better as well. We also, as we all age, we lose muscle mass, which then makes it so that our skeletons don't move well. So all those little aches and pains and joint problems that we get. And so I'd like to put in a specific commercial for resistance training, whether you use bands or whether you use weights, getting with a trainer or going to a gym, or, looking at videos that can help you in your technique to retain the muscle, because your body will function better as well.
Great. And then there's a question about supplements, and specifically for Black women, and whether we really need them, and if so, which ones do we need the most of?
Yeah. So, for a long time, doctors, medicine, the party line was, you only need to supplement those things that you're low in. So I mentioned vitamin D before, super important to make sure that you're working with a healthcare provider to monitor your vitamin D levels over time. But then recent um, research has shown that multivitamins, taking just a good multivitamin every day, is really important for maintaining health in the long run. So I would say for sure, a good multivitamin, keeping up with your vitamin D level, and again, the plant-based diet, eating the rainbow of the fruits and vegetables, will give you 90% of the uh, chemicals and vitamins and nutrients that your body needs.
Great. And I think that's all the questions. There is one more question, but it's kind of related to what we talked about on Saturday. But if Mary's still here, the question is there data to show that dyeing and hair relaxing has caused cancer? And the answer to that question is yes.
Most
Again,
definitely.
yeah, and
I think
I
I
would,
have the stats on my slide, about 9% association with hair dyes, 31% association, greater risk with relaxers and straighteners.
yes, and we know that there's research out there that shows evidence that for hair dyes that Black women use as opposed to those with white women use, because there are darker hair dyes and there's different chemicals in darker hair dyes, it increases a Black woman's risk of breast cancer by, I think, 4 times compared
Yes.
to white women. So there is data and research out there. And again, happy to follow up and connect with you. You can go to our Conscious Black Beauty Movement website or webpage and get more information about that. So we have a few more housekeeping things to cover. For those of you who have to rush, we put the link to the survey in the chat already, I believe. But Sylvie, if you could just run through the rest of the slides. But I want to say thank you so much, Dr. Clarke, for all your valuable information. Just a reminder that we have a second session coming up next month. So be on the lookout for that. Want to let everyone know that we had a promotion and hopefully all of you saw it. But if the first 25 people who registered and showed up today will get a free copy of Dr. Clarke's book, Excuse Me, Doctor, I've Got What? And so we'll be in touch to let you know who those 25 people are. So we will be emailing you directly to let you know if you will be getting a copy of the book. So next slide. And then if you can take a few seconds just to scan the QR code here. We put the link to the survey in the chat, but for those of you who rather use the QR code and scan here, please do so. We'll also give you another opportunity to fill out the survey. We really want to hear back from you as to what you thought about the webinar today, what we could do differently to make it better, what other information do you want to know about how to really take control and charge of your health and live a healthier, longer life. Next slide, Sylvie. So you can follow us and find out what we're doing with all of our education programs and everything else that we have coming up in store for the rest of the year by connecting with us on Facebook, LinkedIn. We're not as much on X as we used to be, I think, for obvious reasons. California Black Health Network on YouTube, where we have all of our videos from the webinars there for you to access, and then also on Instagram. So it's pretty easy to remember. It's at your CBHN, with the exception of LinkedIn and the YouTube channel. You can also join us in the campaign for Black Health Equity. You know, we are a nonprofit organization. We need a lot of support these days to continue to do the work that we do. So if you feel compelled to, support us and join the campaign for Black Health Equity or support us in other ways, please, I invite you to do so. So thank you very much for taking your time out of the afternoon to be here with us today, and stay tuned for the next 4 sessions that we have with Dr. Clarke. So take care and have a great afternoon, and happy 4th of July, a little bit early to everybody. Take care. Right.
Thank you.
Bye.